Medicare Advantage continues to waste a lot of money, up from the $83 billion of last year to $84 billion this year. The Medicare Payment Advisory Committee, also known as MedPAC, came out with their latest annual report that showcases how much money they pay plans, private insurance companies, to manage Medicare Advantage. Medicare is going to pay these Medicare Advantage plans about $538 billion, which is 20% more than if all those people in Medicare Advantage plans had stayed in traditional Medicare. That nets out to about $84 billion. And last year, it was about $83 billion, or actually a 22% increase. So bad, no matter which way you slice it. And it's largely because Medicare Advantage and these private insurance companies play the game to really screw over the American people. First, Medicare Advantage plans, they target healthier individuals that are less likely to use medical care. But because it's a fixed payment per beneficiary that Medicare is going to pay Medicare Advantage regardless of the amount of health care that's used, it means that they actually pay more money for them to be on that Medicare Advantage plan than if they had just stayed on traditional Medicare. So these private insurance companies know that we don't want the people that actually use health care. We're going to target those that won't use it, still get our money from them, and just cash those checks. They make sure that their network is very specific to avoiding very costly treatments like cancer. They make sure they have the benefits like gym memberships that target those that are more likely to use them, or a healthier population. But that only counts for about half of the wasted dollars. The other half comes from upcharging and changing coding intensity. Medicare Advantage members tend to get more diagnosis codes recorded in fee-for-service than traditional Medicare. They're basically just playing the game and stacking on a bunch of codes and higher risk codes that don't have any documentation to report it, to defend it, and there are studies and reports showing that they lack the documentation to defend what they are billing the codes for. So the selective choice of the members is about $44 billion, and about $40 billion of overpayment comes from this coding intensity upcharge. And Medicare Advantage plans are not a benefit to the patient. They lead to a contracted care. You don't have as many available providers to you. It also has longer wait times for getting care because of prior authorization that's needed. Even though these private insurance companies are saying they're going to try to cut back some on their prior authorization, it's not going away. There's still a ton of it. So it's going to be really problematic if the new HHS director, Kennedy, and the person that's being right now going through the confirmation for head of CMS, Dr. Oz, they want more Medicare Advantage plans. That's going to be very problematic to American people.